Hello, my name is Brittany Seal, and this is my presentation on intimate partner violence and sexual assault for my Nursing 665 class. Data from the CDC's National Intimate Partner and Sexual Violence Survey indicates that about 1 in 4 women, which is about 30% of our population, and nearly 1 in 10 men have experienced sexual violence, physical violence, and or stalking by an intimate partner during their lifetime. Some risk factors for intimate partner violence or sexual assault can include low self-esteem, the female gender, a low IQ, low academic achievements, low socioeconomic status, heavy alcohol or drug abuse, aggressive behavior, depression, a history of intimate partner violence or family abuse in the past, isolation, or impulsive behavior. Some subjective and objective findings that you may find with these patients presenting in the healthcare field includes the subjective data is the patient may state they are having a difficult time. The patient may feel guilty for upsetting their partner. The patient may state that they are unable to go out of the house as much as this partner is in control of their life and what they do. The patient may feel out of control of their life, as stated before, the partner has control. The partner may exhibit aggression towards the victim, such as pushing, shoving. The partner may exhibit jealousy or suspicion, and the partner may refuse to leave the patient alone. So, for example, if the patient comes in with a broken bone and they need to go for a scan alone, the patient's partner may not want to leave their side. Some objective behaviors and findings that you may see is unexplained injuries, old and new bruising, fractures in different stages of healing, the patient making poor eye contact, burns or human bite marks, internal injuries, unplanned pregnancies, and sexually transmitted diseases or recurrent sexually transmitted diseases. Some differential diagnoses that you may want to consider before coming to this conclusion is alcohol and substance abuse, as patients with alcohol and substance abuse problems can kind of come in with the same subjective and objective findings. Another one is depression, as this can sometimes lead to self-harm, which could also be the cause for some unexplained injuries. They may not want to admit towards it. And then the third is accidental injury, as this could also present as just injuries with no explanation. For diagnosis and screening, a physical workup depending on the patient's injuries or complaints should be done initially. After this is done, the patient, if they are at risk for intimate partner violence or sexual assault, or red flags are noticed during the intake for subjective data, then screening should be initiated. There are several screening tools that can be utilized to screen women. The first being humiliation, afraid, rape, and kick, which is HARK, hurt, insult, threaten, scream, which is HITS, extended hurt, insult, threaten, scream is EHITS, and partner violence screen is PVS, and finally women abuse screening tool is WAST. The HARK is commonly used to identify emotional and physical intimate partner violence that's occurred in the past year. This is commonly used in the hospitals and it's used in our emergency department as well. And EHITS has additional questions that can assess for sexual violence in these cases as well. Some abnormal findings for intimate partner violence, sexual assault, which may lead you to think otherwise, is subtle psychiatric changes. They might not have any change in their psychiatric evaluation. The patient may not be withdrawn at all in conversation. The patient may blame their own mental health difficulties for issues or injuries instead of blaming their partner. And the patient may present with no physical injuries or signs of abuse. They may just be being emotionally abused or sexually abused that you're unable to see on a first assessment or glance. For their plan of care, each individual should be screened if they are at risk or suspected to be in an abusive relationship. You should treat the injuries with medications. If they have an infection, manage their pain with medication for any injuries, and surgical procedures should be used for poorly broken bones or if serious injury is present. Non-pharmacologic interventions that can be used may include heat or cold application to injuries, elevation of injured limbs, counseling or psychiatric care for depression or anxiety support. The healthcare provider must ensure that the patient is safe and then immediately report by telephone to their state's appropriate agency to report the suspected abuse. In the state of Pennsylvania where I live, you have to do the phone call within a few hours of this suspected abuse, and then in 2 days you need to submit a written report to them as well. The healthcare provider should also educate the individual on what intimate partner violence or sexual assault is. Unfortunately, many of these individuals may not realize that they are a victim of this abuse, and that's why they just have not been aware or gotten help. And finally, promote their health by giving them their support groups, therapists or psychiatric referrals, and housing, financial support information if needed to leave the abusive relationship. Unfortunately, many women in these cases don't have the financial or housing support for themselves or their children to leave abusive relationships. So that's one of the reasons why they stick around and are scared to leave, as they don't have that support. So in the state of Pennsylvania and in my hospital in general, our social workers and caseworkers will come and speak to these women and give them housing and financial support. They'll give them diapers, childcare needs, all of that stuff, just so that they know that they have the finances and needs that they all they need to leave this relationship. And then finally, these are my references, and that's all. Thank you.